I need to approve the minutes,
You
the
got it.
January minutes. Frank made a motion,
I'll second.
Darwin seconded, all four.
Yeah.
Okay, the financial report.
Okay, in operating, we have $1,648,873.25. The CD has $2,043,683.49. Payroll account has $113,228.09 with a payday tomorrow. The retainage account is at $70,946.18. Construction fund, $3,205,217.79.
Rolling right along.
They'll dry up, maybe they could get something done.
Yeah.
Do I hear a motion to accept that?
Yeah.
Frank made a motion,
I second.
Billy seconded, all four.
Yeah.
Yeah.
Motion passes. Administrator report.
So our census is 86, and we've been a little slow this past month. I think the hospital's been slow, all the home healths, just a slow time. But it's been picking up this week. We've had 3 admissions today, and I think we got a couple scheduled for tomorrow. And then our home delivered meals is staying steady right at 35. And we're
Has the government cut out anything on that home delivered stuff? Or what, they just following, what?
No, they have cut it already, but they may cut it some more, what I read the other day.
That's what
Now, what's happening, Frank, is they, TennCare's got a choices program.
Oh.
And they're putting people in these homes, so if they've got somebody already in there that's sitting there with them, they're expecting them to cook their meals, and they're taking away their meals on wheels.
Yeah.
I mean,
Well, ain't nothing
that's
wrong
what
with
I
that.
think.
Yeah, that's part of it, and then there for a while, when we had so many, there was a grant from Walmart
Right,
that had put so much money into the home delivered meals program, and that grant is no
Run
longer.
out.
right.
Yeah, so that would be really good if somebody could get some grant money, give some grant money to do some more, cause it's very needed. Home delivered meals is very needed.
Well, how much does it cost the people you deliver them to? Any? They
Well,
have to
it
pay for,
depends, not if they're choices members, 'cause
what's the
some,
choice member?
some of the choices members, still do get the home delivered meals because their caregiver's not
Income
there during
level.
the time.
Time. It's
So-
TennCare patient, it's.
Yeah,
So-
we collect
Right, thought he
TennCare
was
money.
I ain't foiled again.
We have
Thought
a
he was showing.
contract with, the Upcoming
I
Development
don't
District,
wanna.
and that pay source is,
It's called the options.
yeah, the options program. So we have some through there, and we also have some private pay that pay, privately for us to deliver.
They used to give them an envelope, and if they could afford to pay anything, they would. I don't know if they still do
They still
that.
have that program too.
Do
Yeah.
they?
They don't.
Yeah, but we're not part of that program.
Okay.
Yeah, we're
Okay.
not part of that program.
Well, it's sad.
Used to be pretty good grub, but I don't know about now, it used to be pretty good grub.
I think they.
How do you know?
Cooking them up there.
I don't know.
You been
Over here
cheating?
now, or how, you all
No.
cooking them?
Yeah, we
I've seen
cook,
it.
our meals
You will
here,
not.
yeah,
Oh, yeah.
every day.
Yeah, they ain't
take
frozen,
out.
are they?
No,
Like the meals on wheels.
there's some option, I mean, they can choose if they want frozen, the person theirself, the client, has an option to pick who they want.
Oh,
There are
okay.
some people who choose delivery 7 days, at one time, that's frozen, which I think's a bad deal. I like the person going and seeing them face to face every day, and it's a good hot meal. They have that choice, so.
Is, any changes in TennCare rates for this year? Cause I know that they've been discussing ambulance, so I don't know if it's gonna affect just general.
Well, our TennCare is a mess. I mean, it
you're not the
just
only
is.
one, yeah.
It is so complicated to try because used to, you took care of the patient, you sent in a cost report, and that's kind of what Jimmy's gonna talk about a little bit when he gets here. And so we were reimbursed based on what it costs to take care of a patient. labor costs, food costs, you know, all those different costs. Well, now, there still is a small cost component to it, but it's quality, the quilts program that we've talked about before. We just had to do our surveys, get all that back in, employee satisfaction, resident satisfaction, and family satisfaction. That's a portion of our, teen care rate now, quality. The construction, you know, capital improvements, when they came up 3 years ago, I think, and did an assessment, an appraisal value, that's part of our, reimbursement right now. Also part of it is our MDS coordinator sends in an MDS on every patient, a minimum data set that tells about all the patient and their acuity level and case mix, all the things that they need, and that goes to the state level, and they produce us a, I guess it's a quarterly or a semi-annual case mix identification based on everything that's sent in. And so, if that goes up or down, that could trigger it $1 or $2.
It used to
And
be
we've seen that happen.
quality of their care, it depends on what the need of care is for that patient, I don't know if they still do that.
Are you talking about
She's described
how
it.
sick they are?
Yeah.
Well, that's sort of what that case mix
Yeah,
indicator
that's what the case mix
is.
indicator,
Okay.
yeah.
Okay.
There's that component to it. I mean, there's just so many different components that they just add up. If you're in tier 1 in quality, you get this much. If you're that, you get this much, you know.
Is it still like on a point system? So many, depending on how sick or what their need is and
Are you
everything?
talking about the PAE?
Like 1 to, like 1 to 5 or?
Oh, yeah, the PAE
Yeah.
is on the point system.
Okay,
And that's another complicated part of
Right,
it.
right.
Like we get an admission, they come in skilled care, and then we are going to transition them to long-term care. The family has
Right.
applied for teen care. We have to fill out what's called a PAE. That
Yeah.
means medical approval.
right,
And then Charla also has to do a financial application to send in to teen care. And used to, we had a local DHS worker here in Overton County who did that. Every county had that. Well, they took that away and moved all that to Nashville. So now our residents' family, Charla is their contact pretty
Right.
much. Which eats up so much of her time, where they used to go over there.
right,
And so, you know, we're not teen care, we can't, you know, we don't know what they're gonna do, but we have to send in an application, then they'll respond 9 months later.
Ask for supporting
it-
documentation, you have to gather all the bank statements, the property information, et cetera, from the family, and then we fax it in for the family. We're like a
Yes.
go-between, but the family wants
Yes.
us to tell them if they're approvable or not,
Approvable,
yeah.
it's not our
Yeah.
decision, so
Yeah.
that's the hard
Yeah,
part.
so then they get a phone call from somebody in Nashville who you might understand, or you might not, there's some language barriers, you know,
Be
and that's
nice to
another
get somebody you can
complication.
speak
That's another
English.
complication. So even getting them approved, and then it feels like we're having to fight for our money through the quilts program. You know, we produce good quality here, we really do. And matter of fact, I got, something from the American Healthcare Association today that said we're number 33 out of 316 nursing homes.
Great.
We have to fight for every dime we get.
right.
And these families that we've been working with, I mean, they can vouch for that, cause they've been here fighting with us and getting everything they need, and they're just, it's harder to get teen care money now than it is Medicare.
Right.
I
It
mean,
didn't
it
used to
just
be
is.
like that either.
No,
It
did
was
not.
easier to get the teen care than it was Medicare.
Absolutely, absolutely, absolutely. But to answer your question, yes, there could be a change in,
Or,
we'll know that in July.
He's ready
I've
to
gotta
some
get
road
the
He's full of
construction.
no-show.
budget.
No, he
No show
got-
goes.
He had to come from Murfreesboro, so he had some construction delay, but should be here in a minute.
About 5:30.
Yeah, we're sorry about that, that was my fault, I didn't
You got 15 minutes.
realize that we were meeting here.
It took me that long to get out the
They
door.
go way longer than car.
I didn't wait.
Make
Well,
sure
actually
they still
20,
pull
cause
the
it's
car out for you.
5:10, but, you
That
know.
way. We're the many go out.
There's gonna be one
How
over
many
there
of
waiting
you are
on
they?
us.
Four of you?
Four of us, yeah.
Five,
So they'll wait on us.
4 of us is here.
Oh, yeah, they can't start without you.
It'll be hard.
I don't know, I hear the lawyer say the other day in court that, Ben had told him he didn't need no county commission, he can do whatever he wants to. Ben said,
Well,
Well, you know who caused all that? Oh, we're still on record, ain't we?
it wasn't me.
I better shut up.
And then he rephrased it in a way where he said, well, that might not have been exactly the way it happened. You know how these lawyers are, they will tell things and they hardly true and then back up and go around.
They're
it.
not all like
No, but a
They
good
ain't.
part of it.
All I've ever seen is,
But they're allowed to lie. That's legal for them to lie.
that's what they say. That ain't perjury, is it?
No, not for them. Would be for you.
It'll be the first time I've been purged.
We are gonna get some speed bumps over here at the
Okay.
senior center.
Okay.
Yes, I talked to Betty today.
Well, I'll have,
We'll get them.
I'll have
and
that,
install 'em.
I hope you,
People coming down that hill,
I seen some coming through there while I was sitting out there. before
well, you
they come
need to
in.
slow down.
yeah,
No, I'd already come parked.
just so y'all know, if you get complaints, we are putting some speed bumps up. over there.
I'm complaining about speed bumps.
Well-
They hurt your shoulders, don't they?
I'm sorry about that,
Shoulder.
I'm
you
sorry.
been speeding right through here? Really?
All
Well,
they-
mostly
Hill
coming
at
down
the
that
senior
hill at the
citizen
senior center,
center.
right in front of the mailbox there.
Yeah.
They come through there moving.
Yeah, they really do.
Well,
I mean, it's crazy, but they do.
I wouldn't have thought that. But yeah.
We'll slow 'em down. I'd hate for somebody to get hit there.
Yeah, 'cause, on the days they got, they're crowded on the days they, need that, pretty much.
Yeah, look. That's you, Frank.
Yeah, that's fine.
Oh, I
I
thought.
was calling Trump.
Doesn't send some rain, like
I
that.
think I was calling him up, and then we'll like, the mic, whatever.
No, I don't wanna hear it either.
What's that?
He said, don't start that Trump stuff.
Listen, I'll argue on either side, independent, Republican, or Democrat.
You will.
Won't no darling.
Yes, sir, you will.
I just like to get somebody stirred up sometime.
Well, if you wanna do it, that's a good way to get it going.
I got two right here, so I
Now,
can get stirred up real
Medlin
quick.
and the sentencing on Roger Stone, he wouldn't serve it up.
I'm glad Trump.
Trump,
That's
Trump
something.
Park, after they found him
You're
guilty.
really sorry, ass.
Now, I put it on the
Where
thing.
it's like,
Hey, Mark.
I wanna say hi.
Oh.
So they're getting about to where if it does dry up, they can start making, showing.
Yes.
well, then you say this blocked up something?
Right there.
Good.
Yeah, they got a few more than block up.
Yeah, they're gonna get that side poured Saturday, and then the, should be starting with the studs.
They got the steel up out front there too.
Right. They do.
Yeah, I noticed that.
It's been a sloppy time on trying to work, I'll have to give them that.
Well, that county building's going up, oh, yeah.
It went up, rain or shine, didn't it?
Yeah, they work, it don't matter what it is.
Well, they was out here working in the rain the other day, and I thought, Lord, bless them.
What is,
You notice that stuff they putting around the side of that, you go fell it in, gosh, that's just about that big, heavy as it can be.
Is it?
Was over, I mean, Ben was over the other day.
that's keep you
They
in
had a
just your
little
bone from breaking
Piece
through
of
it.
it there,
You don't wanna call it a lawsuit business anyway.
shut up.
You up on the top floor?
Yeah. We went down by.
Oh, we had to call the law, he was fixing to jump.
Big, it was a great big
He
place.
was fixing to jump off the top floor.
Well,
I had my parachute.
Is he not?
Well, who is coming?
Is their accountant, the guy that's been here before, Jimmy Joe?
Jimmy
or
Joe.
What's your hurry? You're hitchhiking anyway, so.
That's the reason I'm in a hurry, I'm afraid of my driver.
You got a driver?
I'll let you drive.
I'm riding
Oh,
them.
God.
Oh, from here over to Annex.
Oh, I was gonna say, he was here, you went with him when he pulled in.
Oh,
I tried to, you let him come pick him up, he was up on top of
You
the
are
hill.
driving, he is driving,
He could get away.
Couldn't get away
Who's
right
driving?
there.
you're driving?
Well, hell, I drove myself home from hardware when I broke it.
Tough old goat, ain't he?
When did you finally go decide to go to the doctor?
Huh?
When did you finally decide to go to the doctor?
Had his daughter come.
When
home.
my $3 got hold of me.
Oh, okay. Okay.
The youngest one was probably the worst one.
No, the oldest. She gets on you, you just gotta go down to the ground and give up.
What's her,
Tracy,
I don't know.
Where she live?
Gordon,
Corbin, yeah.
I was about to have to go down there and live for a while.
Well, we would've been in hog heaven. for a
Yeah, I
while.
know. That's reading that stage.
What's her number?
We'll call her and tell her to get you
I'll
down.
call, tell Connie we'll get you in sleep. Hey, Connie.
Oh, we're snowed in.
Hey, we're over here still at the nursing home meeting, we're waiting for somebody to come in, so we're gonna be just a few minutes late, okay? Alright, we'll be there as soon as we can, okay?
Now just go ahead and start with that.
Yeah, go ahead and start, get part of
Go
it.
ahead and have most of the meeting.
Get all the
Be ready to
blood, get all the blood out of the way.
Get ready to adjourn right in front.
We started on, we start tonight on the budgets for the whole county, so we're gonna start working on those.
Can't be too late, I better get home.
You
Well,
gotta go down.
Hey, make me some money.
I think it's a nonprofit or something.
Your wife's gonna find out about that hay
We
bitch.
got people working there tonight.
Hey,
Better keep
No,
your
we
mouth
discussed
shut.
it,
Oh,
what she don't know on her, she's got a little book over there of everybody that I tell her whose hay I cut and how much they owe me for it.
Oh, she keeps the money book.
I just might not
Oh,
tell her
yeah,
about
We'll
all
set a
that.
date for the next meeting.
Yeah,
Or
let's
wait.
set a
Yeah.
date for the next meeting.
That way I'll do this no more, schedule it for the wrong time. For March.
Don't worry about it, darling.
I don't know.
I need to have a word with you sometime today.
Okay.
No gravel's putting my driveway.
Okay.
No, I'm kidding.
I'll have a
good
lot
for
of
y'all.
calls there.
well,
We got a salary meeting
Twelve.
and
We'll probably have to do it.
highway meeting at 12.
Yeah, we'll have to do it tonight.
5 and 5:30.
I can't be here the 19th.
Okay.
I'm spring break, I won't be here.
Okay.
Why?
I'm going to Gatlinburg.
Well,
We don't care if you're going. We
we're
can
all
get
tied
along
up that
without
whole
you.
week, so we'll have to do
11 or
it
13th one. Yeah, what was it?
the 13th on Friday,
Yeah, that's
Alright.
right.
12th
Fine with
Saturday.
me on Friday.
So, you will either have the 16th, we'll have to do it either the 16th or the 26th, looks like. And you're going spring break the 16th, right? And it's 16th through the 20th?
Yep.
So I guess we'll have to do it that fourth week. What y'all think, what do you think about that? What, was it good with
That's
you?
fine with me.
Don, how about you, Mom?
I don't care.
I mean, that's all we've got open, guys, cause he's gonna be gone. And you're tied up on that.
We don't have to close the county down just cause they come.
You might,
26th,
you just might.
That's probably best for me. How about you, Randy?
Yeah, 26th, all right.
Frank?
26.
But I'll be going the next week.
I may have to work that day.
Okay. We'll say it. 5 o'clock.
Yeah, that's
5 o'clock,
fine.
okay.
Right.
I'll be as happy as you can, while you can, I guess.
Yeah. I'm gonna be gone the first to the
Well, I
fourth.
don't give her a hell of a
Alright,
damn.
okay, so we ain't
So
gonna,
if you said anybody's meetings,
yeah,
Sure,
tell them
that's
mind
fair.
that.
yeah, we won't set nothing then. You talking
I'll
about-
be here the 30th and 31st, but I'll be gone from the first to the,
Oh,
Don't
okay.
say nothing for the 32nd, cause I'm gonna be out of town.
Okay.
I'm sending you a bill 30th.
Frank's going on the 32nd.
Well, I'd believe it if you would've said the 29th. Y'all got a leap year this year,
That's right.
366 days. So, we'll just set everything that week, the second week of April then.
somebody posted on Facebook that they needed 2 workers.
Do
for the
what?
30th,
We'll post all our
31st
meetings the second week of
February.
April, or
Gonna
the third
pay
week
them
if you want to.
$5,000
Cause,
plus
Well, yeah, we can go ahead and put them up there,
Yeah.
and we can guide the others over there around.
$1,200 to
right,
eat.
that's what I
You
thought.
wouldn't believe the
Yeah, you
people
work
that
on
were
it. Get her to
posting
just set 'em
my
here.
eyes.
We'll work on them.
They didn't pay attention.
No.
They was focused on that money.
Who's
He
coming?
ain't on.
I don't know if he's been here since. Has he been here?
He's not been no.
Who invited him?
Who's coming?
They said Frank Martin did.
No, I didn't.
Frank wants to know who's bad.
Yeah, you gotta
Well,
stop
then
saying
you go
about it.
find him and bring him in here.
Go wrestle him in, let's throw him in.
Who'd you say it was?
Jimmy.
Oh,
He
this,
may-
with
he
this.
may still be in cooler.
I didn't put the word together.
He may have stopped and eaten Cracker Barrel for you.
Yeah, that's probably, he probably.
That's where I'm going, it's my birthday.
Congratulations.
You may be late,
Happy.
waiting on him.
They're open till
I'm not-
late,
I'm not.
it's all right.
So you're going to Cracker Barrel?
Yes,
You can hardly be Cracker Barrel.
it's my favorite.
I'm going to still cook.
You
that
think
one
he
back.
take you?
You got, you better have a big
Oh,
pocket.
you get it? Well,
You know, it's not
You
that.
go-
My husband's
not?
from
No.
Warren
They tell
County.
me.
Yeah, no,
oh,
let it
I
go.
take a ball trip?
Well,
I try about once a month.
Radio.
And it'll cost us about,
Oh, that's right.
probably $5 more
I
than
think
we'll
we're
need
about
to make
$5.
the restroom down here. And we get water down there, we get
Maybe.
Coke or something over there, you know, so that
Girls,
makes up
girls
the
are good
difference.
at
It
it.
ain't-
Boys are.
And good food.
Some of them places charge $3.
Boys ain't gonna go, it's our boys ain't gonna go.
But
Girls ain't gonna
you
go.
know, with a meal.
They
When they get out of the district.
might be tied.
When they get out of the district.
Huh?
When they get out of the district.
They're going to play better than they have the last couple games.
Who's that?
York beat them last night, not for that.
They got a game tonight too.
There he is, there he is. Come in, Jimmy.
Sorry,
Come in,
late.
Jimmy.
We just untied the hangman noose from your
Oh.
thing.
Go take the horse.
Huh?
Go take the horse back, and see if you're gonna have to get the hang.
You didn't stop at Cracker Barrel on your way in.
No, I wish I had.
Go way after this, that's right.
Yep. Just trying to figure the way in.
Yeah.
So we'll turn it over to Mr. Jimmy.
Again, I'm sorry, I was late, I got instruction.
We've not
Then I
even,
got in here.
we've not told them what it's about, right? Did you already tell them? Okay,
No.
all right. So, Jenny, I'll let you explain it from the beginning then.
Okay. Every once in a while, Medicaid or TennCare will do an audit of facility. We were lucky enough here to get chosen this time, and they come out and they go through all your finances and the cost reports that we file and make sure everything's okay. You know, some facilities can run into a lot of big problems. I think we've got a couple of points here, but I think they're pretty minor issues, all in all. So we wanted to explain what they are. There's two findings that they had here. One of them is there are times because of the reimbursement system that Medicaid may pay when the patient's already paid, or they may pay at the wrong rates, and sometimes that results in credit balances that a patient might have. And they want you to find those credit balances and issue them back to whoever they belong to within a few months, 60 days. Kind of difficult because sometimes you don't even know you got them in 60 days. They did find some credit balances that I think we'd even tried to give back to Medicaid, the MCO, and it's almost impossible to get them to
Take the money back.
So they had found what amounts to $26,000 in credit balances. We dispute about 4,400 of that really should not be. We think they got it wrong. So about 22,000 that needs to be issued back to Medicaid, basically, or the MCO. It's not money we thought we'd earn and have to give back. It's just money we over collected, really. So it's not gonna be like it's a reduction of revenue or anything. It's just gotta give it back to Medicaid. So, and I don't know like I said, it's kinda difficult to give it back, but we think, I guess we're getting close to getting that resolved. That was the first issue. The second one,
Can I add, I don't mean to interrupt you, but these are not just, these are years back too. I mean, these credit balances are some that even were here before Charla was here. So I just don't want everybody to think, okay, you know, it's just recently or whatever. It's from years back that's been on our books.
and this is something that happens in every nursing home. I mean, you're gonna have situations where you get these credit balances all the time. You know, a patient may come in and pay for a while, for a month or so, and then Medicaid says we'll approve them, and then they go back, and that patient's already paid us, that's when one can come up. You know, so it happens all the time, but,
So are we actually exchanging money, or are we just moving numbers around with this reimbursement?
we're gonna actually have to give it cash back.
Actual money?
But we've already, Charla's been working on some of it refunded.
Okay.
It's already, we've already done about $14,000
Yeah.
to $18,000
And the second one doesn't involve any money at all paying out. It's, what they're saying is that, and this one really is on us because we prepared the cost reports. They're saying we classified some of the revenue for some of the days in the wrong category. In the last few years, Medicaid has come out with a new cost report. They came out with a whole new system of reimbursement, and they came out with a new cost report. And there was some confusion on where to report here, specifically the cottages is where the majority of it was. And we put it in a other category, and they wanted it in Medicaid's category. And it's a little confusing because the Medicare cost report does it one way, and the Medicaid cost report wants it another way. So, it really is just where we showed it on the cost report. Like I said, that's us, cause we didn't understand that, but they're saying in 17 and 18 that happened. In 18, we actually discovered it, talked to the state, this is way back, talked to the state, and they fixed it on their desk review, they say, but they still pointed it out in here that even though we had told them, you know, we realized that was in the wrong slot. So, like I said, that doesn't make any monetary, it doesn't mean any cash or anything, it's just, you know, we figured out how they want it now, and we can report it the right way, but they felt like they had to,
Smack our hands.
yeah, they had to tell us. So, we've got responses to the report on this. That one, you know, if anybody sees it, it kinda looks bad because the numbers are like $2 million one way and then $2 million the other way. So, that's the only bad thing about it is, you know, if somebody looks at it, it appears like it's a big deal, but it's just which column it was in. So, we wanted to explain that to you so you understand if anybody asked.
But from here on out, you know which column to put it in, right? So it isn't fixed.
Absolutely, yeah,
Okay.
yeah. And this being, the cottages, we don't have this problem really in other facilities because you've got so many days that are in this category because of the cottages. So that's why it's a big number, but it's, like I said, we got it resolved and we'll know going forward where to put it, so.
And that don't change our rate, it don't do anything.
It has
It's just a line item in the wrong area.
no
Right.
impact at all on it, not like the other one, so. But,
anybody got any questions for?
So that's the draft, we've written a response, it's been submitted, so then the state audit will do a final.
And then they come back with their recommendations or their final ruling or warnings or what?
I think once they get your response, that's all
All
they,
it is.
the finding will, now, it'll be posted, that's the other thing, it'll be posted, if anybody wanted to see it,
Yeah.
they could find it on the website, but like I say, I think we could explain it.
Yeah, and one thing on these credit balances too, we have a Medicaid patient in here and they get new dentures. We can item D, what's called an item D process on that. And TennCare has really been bad as far as putting the item D in and so that reduces their patient liability to us and TennCare pays more of that money. And then when the item D comes off, the patient pays more money back. And sometimes they don't get that right in the right month. So the item D could go for 3 months when it only should have went for 2. And so TennCare then, just getting that correct and for TennCare to pay the right amount and the patient to pay the right amount, that's an obstacle. And when you have 65 Medicaid patients and that happening, and it's put our dental provider, as a matter of fact, in a big quandary right now, because they're not processing the item Ds correctly, then the patients are not, and it's not just our facility, it's statewide, they're not getting paid the dental services. So they've had to go to a insurance model to where the patients now are going to have an insurance come out monthly. Did you know that?
A dental.
A
you're
dental
enrolling in.
insurance monthly, instead of doing the item D process. Instead of paying for the dentures in 2 months, you just pay a monthly fee, and you pay that forever, and you get whatever dental services you need.
So TennCare does not have to go in and adjust the account except once a year.
Yes.
For that 100, whatever it is.
So and I say that just because part of the way they do things creates messes like this for us.
Right.
It just does.
But then they come back in and grade you.
Yes, and when they were here even, they said, we see this everywhere. Yeah, you do, because it's the system. It's the system that, it's just not perfect, and, it's just difficult system.
But they gotta find something to keep their job.
Well, that's a big part of it too.
Well, I'm
so.
very happy with it. I mean, yeah, maybe we got some credit balances, but, I mean, we've seen a lot worse in other places.
Yeah,
So.
I just went to meet with the comptroller's office in Nashville a few weeks ago about one where they're trying to charge them over $1 million, so it gets real,
Yeah.
a lot
Yeah.
worse.
Yes.
And, so this is,
22,000 is minute
It's
compared
not-
to.
Well,
Yeah.
think about all the revenue that we've collected in all
Right.
those years.
Right,
That's a lot of revenue.
yeah,
right.
And,
yeah,
yeah,
so.
22,000 is not, Charlotte does a fantastic job.
You know.
She is the best I've ever seen. The best,
I'll second that.
That's 'cause I'm old.
the best I've ever seen
Yeah.
at it.
Old and set in your ways.
Yeah.
When we have a question, we call Charlie.
Yeah.
so.
Yeah.
She knows that. Did y'all want me to kinda go through it?
It doesn't matter, I just brought this in case y'all had any questions about any of this.
Yeah, that's pretty straightforward for me.
Okay, all right.
Seeing how-
I just thought while he was here, if we had any questions, we could talk about it, but.
No, that was a
Okay,
clean opinion, everything was
Yeah.
all
in
square,
order, yeah.
yeah,
so things continue to go well.
We-
Yeah,
we're-
yeah.
We're trying to keep moving.
yeah,
Yeah.
aren't we?
yeah, yes, we are.
Moving forward.
You
Well,
got a
these
mess
boys
here,
has
but.
got another meeting to go to, I'm sorry. I didn't mean
what's
to,
it?
I said, these boys has got another
Oh,
meeting to go
okay.
to, I'm sorry, I didn't mean to cut you off.
No,
Yeah, we
no.
do got a mess, you're right.
Yeah,
Yeah.
yeah, but it's gonna be
It's gonna be a
good.
good mess, it's gonna be a
Right,
good
It's gonna be
mess,
good.
Jimmy.
Thanks for coming
Yeah.
out.
Oh,
yeah. Time.
No problem, I'm sorry I was late.
That's okay.
Next time Frank can bring his helicopter.
Yeah, there you go. There. But Frank
I like
don't
that.
fly.
Yeah, do I hear a motion to adjourn?
Darwin,
whatever.
All
Well,
right.
I'm getting start with our